Hello viewers, welcome to my channel. So today's video I am going to discuss about nursing process. First I'll come to introduction. Nursing process is a problem solving approach used by nurses to meet the needs of the patient. The nursing process is the systematic rational method of planning and providing nursing care. That means it is a problem solving steps by the nurses for the patient who is having some kind of health issues or health problem. Here we can give an example of a person who is having fever. Okay, so to reduce the fever, the nurse will give some care to the patient. Now, so here how the nurse will plan the care, what the goal of the nurse and how the nurse will implement the care, this thing will come under nursing process. Next, come to definition. The nursing process can be defined as an orderly, systematic way of identifying the client's or patient problems, making plans to solve them, initiating the plans, or assigning others to implement the plans. That means how we define the nursing process, that is a sequentially and step-by-step process of collecting health status of a patient, and then after identifying the problem the nurse needs to make some plans, okay, to solve the patient health problem or health issues, and after planning the nurse will initiate the plan of care to the patient. Next we'll come to the purpose or objectives of the nursing process. So primary purpose of nursing process is to help the nurse to manage each patient by giving nursing care intellectually, scientifically and judicially. So here intellectually means how efficiently the nurse can give care to her patient, and scientifically means by maintaining a proper scientific method, and judicially means by maintaining a legal manner or a legal way how the nurse will give care to the patient. This is the primary purpose. Next, some other purposes are there. So first is to help the patient in maintaining health. That means maintaining a good and a proper health. Next is to protect the client from illness. That means to protect the patient from the further occurring of any kind of disease. Okay, next is to identify the client's health status. That means what is the patient health condition or the severity of the disease, etc. We need to identify in the nursing process. Next is to identify the client's actual and potential health problem. That means here we need to identify the actual health problem. That means actual means the original or actual disease of the patient, or other potential health problem means any possible disease that can occur to the patient. Next is to determine priorities. So here determine priorities means which things are most important to do first when the patient is admitted in the hospital. This is the priorities. Some priorities we need to give as a nurse to the patient. Next, come to initiate plan for meeting the identified needs. That means as a nurse we need to specify the necessary needs of the patient for the recovery of the patient. That means we need to identify the necessity of the patient. Okay, next is to deliver the specific nursing interventions. That means specific nursing interventions for specific health problem need to give to the patient. Okay, next is to evaluate the effectiveness of the care that has been provided. That means to notify or identify the effectiveness. That means what is the recovery state of the patient that need to identify. Okay, that means effectiveness of the care, that if the patient condition is been improving or not, this thing we need to evaluate. And the last point is to promote the recovery from illness. That means if a patient is suffering from any disease, by giving nursing care the nurse need to promote the health status of the patient. That means we need to promote the patient health status if a patient is suffering from any kind of disease. Next, come to the steps of nursing process. So mainly 5 steps are there in the nursing process, but here I have added some additional steps, two steps I have added. So one by one we will discuss here. So first is assessment. So assessment is collecting, verifying and organizing data about the client's health status. Data about physical, emotional, developmental, social, cultural, intellectual and spiritual aspects of the clients. So here collecting means gathering of the data and verifying means whether the data is correct or not. You need to confirm it that has been collected from the patient. And organizing means maintaining a sequence when collect the data. Okay. So the aspects of the data collection could be physical or emotional or developmental or social, cultural, intellectual and spiritual aspect. The aspect could be anything. Okay. So suppose a patient has come to hospital with fever. Okay. So how will collect the data? First, we need to collect the patient identification data. Okay, that means the patient name, age, and then the patient gender, etc. Okay. Next, the chief complaint. That means why the patient has been admitted in the hospital. Okay. Chief complaint and other health histories. Okay. Next, we will come to the physical examination. That means head to toe examination. Okay. So in the physical examination, suppose we need to collect the vitals, the temperature, pulse, respiration, BP. So here I have given that suppose patient temperature is 104 degree Fahrenheit, pulse 79 beats per minute, respiration 18 breaths per minute, and BP suppose 128 by 84 mm of Ag. So this thing will come under assessment. So next step is nursing diagnosis. So it is a process of making a clinical judgment about the client's potential or actual health problem. In this phase, the nurse sorts, cluster the data and analyze what are the actual or potential health problem for which the clients needs nursing assistance and care. That means it is a clinical judgment or clinical findings, okay, of a disease. So the disease could be potential or actual. That means any possible disease or any actual disease can occur to the patient. We need to identify through nursing diagnosis. So from previous example, we can see that the patient is having the temperature of 104 degree Fahrenheit. So the clinical findings is that the patient is having hyperthermia. Okay. So hyperthermia means when the body temperature is nearly 105 degree Fahrenheit. Okay. So from here we can say that the patient nursing diagnosis is hyperthermia. So next step is goal. The goal is the phase where outcomes are formulated that directly impact on patient care. Okay. So before giving any kind of care to the patient, the nurse set their outcome or goals regarding the nursing diagnosis. So from the example you can see the nursing diagnosis is hyperthermia. So the goal of the nurse will be to reduce the body temperature. Okay, the goal is here to reduce body temperature. Okay, in normal. Next step is planning. So it involves a series of steps in which the nurse and the clients set priorities, formulate goals and expected outcome, and establish a care plan for nursing intervention. So the plan to resolve or minimize the identified problem of client. So here in this phase, the nurse will plan what care she can give to the patient to meet the goal. Okay. So here in the example, the nurse can plan to give cold sponging or antibiotic medication for the patient to reduce the body temperature. Okay, so this is the plan. So the plan is to give cold sponge and the antibiotic medications. Next step is rationale. So rationale is expressible of the planning based on reason or logic. That means here in this phase the nurse relayed the reason of choosing the plan that has been given to the patient. Okay, so suppose the nurse choose to give cold sponge and the antibiotic medication to the patient. Now what is the reason to give cold sponge and antibiotic medication? To reduce the body temperature. Okay, so this is the reason. The reason is the rationale. Okay, next come to the implementation. it is putting the nursing care plan into action. During the implementation phase, the nurse continues to collect data and carries out the prescribed nursing activities. That means in this phase, what care the nurse has planned, she will apply or implement into the patient. Okay, so that's why it is called the action phase. That means the nurse will give the care that has been planned before. Okay, so here in the example, the nurse planned to give cold sponging and antipyretic medication. So in the implementation phase, the nurse will give cold sponging and administer the antipyretic medication to the patient. Okay, so the next step is evaluation. This is the last step of nursing process. So it is the assessing the client's response to nursing interventions and comparing the response to predetermined standard. These standards are often referred to as outcome criteria. So evaluation means after giving the care that has been planned, what is the ultimate condition of the patient? Okay, that means the ultimate outcome of the health status of the patient is called evaluation. That means what is the patient health status. Okay, suppose in the example we have given the cold sponging and antipyretic medication to reduce the body temperature. So after giving the antipyretic medication and cold sponging, the body temperature will be decreased, okay, or will be at normal. Okay, so this is the ultimate outcome of the plan that has been given to the patient. So this is all about nursing care. I hope you understand this topic in this video. So if you have any doubt, you can comment below. So I'll see you in the next video. Until then, take care.